Here we go. A very good afternoon to all who's joining us on Facebook Live right now for a very special edition of the LITE Breakfast with Bel and JD Health-Wise Free Clinic. Of course, we have Dr. Rajbans from the Malaysian Wellness Society with us, President of the Malaysian Wellness Society. Dr. Rajbans, how are you feeling?
Good.
All right. Ready to answer some difficult medical questions.
It is the free clinic on our Facebook Live. So if you have any medical questions at all, you can just write them down on the comments down below. Or actually, no, I don't have the DG Light line with me anymore. I've left it in the studio. Yeah. So you can you just comment. And down below any questions that you might have for Dr. Rajbans, and he is right here to answer these questions. Okay, let's start with the first one that we received from Intan. All sorts of busy here today. Intan, I'm in my 40s now, but still suffer from pimple breakouts, eczema, and hives. Does it have anything to do with the weather? Because once it gets hot, dry, and dusty, then my nose gets runny. I try my best not to take too much antihistamines for fear my body will develop an immunity to it. And I've tried all sorts of natural soaps. I eat as clean as possible, but it still flares up. What else can I do, doctor?
Yeah, I mean, if you're looking at this whole things you're talking about is allergies, eczema, so these are all part of the same category. She's probably having a lot of inflammation going on in the body. Now, things like heat, she says some sort of allergies can do it. And, even things like the weather, the weather. But most of the time, it's just some toxin, some sort of food that she's probably allergic to. So these are some of the things that she has to look at. I mean, she's good, she's eating clean, and she is trying all the like natural soaps and all that. But the other thing that sometimes we don't realize is things like stress, poor sleep. All these also can increase your inflammation, can actually trigger off this type of symptoms. So I would actually try again looking at her whole lifestyle. So eating clean is very good. Look at the environment, anything there that could be causing allergies. If worst come to worst, she has to go for an allergy test or look at food intolerance. These are some of the things that can be looked at. Time being, I would want her to even try a course of probiotics she's not tried before. Because probiotics, they say sometimes the toxic gut syndrome can also cause this type of symptoms. So these are some of the things he has to look at. Now, I would really, very bad situation like hers, I would really want her to go into a whole sort of cleansing diet. So looks at things like detox, sometimes things like intermittent fasting can help. So it's a whole lifestyle change that she has to look at. And because it's just chronic inflammation going on in the body, and these are all part of the same spectrum. Her eczema, her allergies, part of the same spectrum.
Pimple breakouts as well.
Yeah, it's the same thing. When you're young, maybe it's a bit of they say the hormonal things, but as you're getting older, like this is all part of free radicals, inflammation, and this is a whole spectrum there. Food, your stress, your sleep, toxins, chemicals, a lot of things that are going in, and that could be even from your environment. So it's a whole thing to look at, not easy. I agree with her that too much of medication like antihistamines, or sometimes doctors can give you steroids, all these I would avoid if really possible, unless it's really severe. And even if you do take just a short course for a while, right? But overall, this is the thing she has to do. Overall, like I call it like an overhaul of your whole body,
Does going for something like Chinese medicine, because technically isn't something like this what Chinese would say is your body is heaty in a way? Is it true?
Yeah. So I mean, I think when they mean by heaty is probably inflammation that we talk of in the Western doctors. Sometimes it's a good idea, looking at alternative therapies, whether you look at Ayurveda or Chinese medication, homeopathy. So sometimes they have therapies that might be helped, because Western medicine, we only can control symptoms. We don't have cure. It must go to a qualified person, because whoever you're going out there, if it's alternative, make sure it's someone very qualified. Today the Ministry of Health has a list of people who are in complementary medicine or alternative medicine who are registered. So when look at that. So but try the lifestyle first and see where she or whether that helps her.
So you do get immune to antihistamines if you take it too much?
You don't get immune, but ultimately, they just symptom control. I mean, you take it for 5 days, you stop. Your underlying problem is there, you're going to come back anyway. So you're going to keep on taking drugs that are just going to cause more side effects. Makes antihistamine make your mouth dry, make your skin dry, and some of them will make you drowsy. So I wouldn't want to take that unless really necessary for a short while, just for symptom control, because they don't cure you anyway.
Now, Dr. Rajbans, on a related note, I know a person very, very well. Okay, fine, it's me. I just don't know because sometimes I don't know whether I don't have pimple breakouts on my face or anything, but I sometimes get boils that because sometimes I'm tired, I'm sleepy, I don't sleep well, or whatever, I'm stressed. I get boils in the strangest places. I won't tell you where, but why do they happen? Is it the same thing as eczema and hives and pimples?
No, this boils basically is infection, and there is normally because of skin infection like streptococcus or staphylococcus, and that normally happens when your immunity comes down. So sometimes what you're saying is, stress and, not enough sleep and sometimes wrong diets and all that. Actually, it's a stress to the body. So your immune system actually comes down and you're actually getting skin infections, right? So these are some of the things you have to be careful because that means suggest your immunity. Go ahead. You don't have diabetes or anything, isn't it?
No,
But that's the one thing you have to really look at. If people get boils, you must check for sugar.
really.
Otherwise, it means, yeah, because people with diabetes are more prone for things like this because again the immunity comes down. So a lot of time people don't know. That's why when we talk about this COVID, it's your lifestyle that actually about the outside things we talk about. Your social distancing and all hygiene and everything very important. But building up your immune system is also very important. So the right diet, exercise, having the right amount of sleep, reducing stress, maybe certain supplements to build up your immunity. So all those are important. But sometimes we forget about that part of it. So I think that is also very important. So you just check
How
and see
do we
what
know
causes your boil. Sorry, what's that?
How do we know what is a boil and what is a pimple? It could be a pimple that's a very large pimple. Does it
Yeah,
turn
but
into a
basically
boil?
both of them are basically infection. The pimple also is just some infection that's going on. Boil is probably getting bigger. That means the infection is getting, what in the simple words, getting more, right? And so sometimes boils you end up having to take antibiotics to cure it, antibiotic creams. But if you find your immune system gets better, it will go away.
Oh, okay.
So it's all got to do with your immune system at the end of the day.
We were just talking about this because Bel and I are very particular about our of eating well now. Because we hang out with you so much, Dr. Rajbans, that you always talk about the blue zones and eating well because that's the real key to keeping yourself healthy. But I never knew that boils could be the sign that I might not be eating as healthy as I should be. Maybe I might be diabetic. Really?
Good to check. When was the last time you checked your sugar?
I know I'm a sweet guy. I never knew that there's a lot of sugar.
Check. Just make sure.
Have you ever checked for your sugar levels, actually?
No, I don't
JD?
have a history of diabetes. Oh no, my grandmother had it. Maybe I should go and check it just in
check
case,
it.
right?
Just in case, yeah. And get them do the 3-month sugar, the HbA1c, the sugar in the cell, which is more accurate. So just get that done. Just to rule out, and then after that, again, look back at your, a lot of times simple things like poor sleep or stress itself, people don't realize can reduce your immunity,
Yeah, because it doesn't
Then
happen all the time. It's just
Yeah.
once in a long while. Like once, then it happens once every 2 years, and after that, it doesn't happen for a few years, and then it comes back.
They can't be diabetes because diabetes they get it very recurrent very often. So that is probably just the phase where your immune system came down and you get a so I wouldn't worry about that. Yeah.
But I still should check
Still check your
my
sugar.
diabetes.
Yeah.
Just check and see. All right.
We're joined today by Dr. Rajbans for our free clinic on HealthWise. And if you have any medical questions at all, you can leave them in the comment section below, and Dr. Rajbans will be able to answer them directly for you right now. And we have a question from Liz Hodges. Dr. Rajbans, may I know if I take glucosamine plus 3-in-1 for my knee can help that I don't have to go for knee surgery?
Yeah, I
Can
mean,
someone take glucosamine? Yeah, just to help their knees.
yeah, I mean, when she said 3-in-1, they talk of glucosamine, chondroitin, and MSM. And it all depends on what stage your osteoarthritis is. Because you grade 1 to 4, grade 1 is very early. Grade 2 is there's some, inflammation going on and some damage. Grade 3, where they are, you're losing most of the cartilage and your joints are getting worn out. Grade 4 is basically all the cartilage is gone. Now, I think if you're still in grade 1 or 2, taking things like glucosamine might sort of help the pain, might sort of, delay the progression of the disease. Very contra. Some studies say they do, some don't. They say they don't. Um, but basically, from my own patients who I've seen who start early, they sort of, get symptom control. Their pain gets better, their mobility gets better, and I think that's good because they delay. But once you go to grade 3 or 4, I don't think so. You those supplements will help anymore. Uh, Now, why do you need surgery? Very simple. One is the pain is unbearable. That means, in spite of all the modalities you're using, the doctors are using, whether physiotherapy or painkillers, your pain is still not getting better. Even pain at rest. Number two is affecting your activities of daily living. Like some people still want to go out there and swim or ride a horse or play golf, and if they can't do that anymore, it causes depression. So they want to get their knee operated on, right? Where somebody else who is just happy, just as long as they can just walk in the walker, they don't mind. That's enough for them. So the involving activities or dealing is varies from person to person. So some people want to be more active and this knee is really causing them an issue. They might want to do surgery earlier. And the other one is the pain. But doing a surgery again has got its own consequences. So though it's safe nowadays, but still, you want to prevent that. So again, picking up things early, exercising, getting your quadricep muscles strong, making sure the muscles around the joint are strong, uh, trying all the supplements and all that will help. Now, the own studies have shown grade 1 and grade 2 respond well to stem cell therapies, and a lot of research going on in that. So, once again, if you have gone to grade 3 or 4, you again stem cells won't help. So, it's important to see where you are, and if you have a knee pain, go and see a doctor so at least he can tell you where you are. Is it really osteoarthritis, and if it is, what grade are you in, and what are some of the? There are also other medications that are non-painkillers that have some benefit on osteoarthritis. There are different type of supplements that are coming in, made from soy, made from avocado, and all that seem to have some benefit. So these are some of the things. Muscle extracts are helping. They say omega 3s may help in some of the inflammation. So again, go back and talk to your doctor and see what you can do to prevent or slow down the progression. As long as you can. Ultimately, if surgery is option, then no choice. But if you can delay it or prevent it, that'll be the best.
Does
So
this
just
affect only
taking
older?
glucosamine.
Sorry, Bel, go ahead.
So just taking glucosamine will not help if the problem is already in stage 3 or 4.
Yeah, then I thought it will help much. I mean, still can try to see whether it helps your pain, but I doubt it will help much at that stage. So it helps much in the earlier phase.
It's
What
mine is
if,
actually
like, for
something related to
example, we
Bel's
don't have
question.
any knee problem? Sorry, JD, you go first.
So if this only is this only something that older folks go through, joint pains? Because at what point, I mean, should you be in your 30s or 40s when you start feeling joint pains, and then you should start taking glucosamine?
I think all depends again. Some people, because of trauma, the way they have. See, I have a problem with my knees because when I was younger, I used to play a lot of hockey, a lot of injuries. At the same time, I used to run marathons at those days, half 10K, half marathons. So, combination of that, I did have a problem with my knees. So I got patients in the 30s and 40s who have, you know, jogging on the hard surface with bata shoes is one no, and people do that. People don't know, they're younger, they think anything is possible. So trauma during sports can cause damage to the knees that to start the inflammation going and arthritis start. So we got patients in their 40s and 50s who had to go for knee surgery, and you want to avoid it because good that the joints now are much better. They can last more than 20 years. But still, if you get a surgery done in your 40s, at your 60s again, you're in trouble because you might have to do another one. Uh, so you want to delay that and all. But yeah, I agree with you. Most of the people who have OA are in their 60s and above. Right? Most of them are older people, but some, because of trauma or sports injuries, can get it earlier.
Now, for example, for someone like us in our late 30s, in our early 40s, and we don't have knee problems yet, if we take glucosamine, will it help in the long run?
Actually, it's no point, because I thought if you have any issues, you don't simply take something for no reason. Now, remember, glucosamine is normally contraindicated in diabetic because, like the words
Oh.
say, glucosamine, because it can shoot up your sugar in diabetics. Now, what about normal people? I'm not sure. So, if you start taking glucosamine at a young age without any symptoms, we don't know whether taking it over how long you to take it. 5 years, 10 years, 20 years. You don't know. You don't know whether over long term it will disturb your sugar. So, I would just go for good exercise. Make sure your quadriceps are strong, the muscles around the joints are strong, and that's what you should focus on. And don't do anything that will damage your joints, lah. That's basically prevention.
Are there any supplements that we can take to prevent osteoarthritis from developing at later age?
I don't know whether there's anything to prevent, but I think one of the focus, osteoarthritis is an inflammatory disease now. We know it's inflammation, so acute inflammation do occur. And what you can do is take things that reduce inflammation overall. One is a diet that's full of, anti-inflammatory stuff, so your vegetables, fruits, your herbs, spices, things like turmeric and cinnamon and all that. And they say some supplements that helps in inflammation, like your fish oils, omega 3s, your turmeric. Uh, all these things that reduce inflammation, the body probiotics also can help that. uh, Taking antioxidants to reduce free radicals, so whether that will help in prevention, we don't know, because prevention studies are very difficult to actually do, because you don't know how long it will take and how long you have to monitor people. So but we know that this eating the right diet, taking the right supplements can reduce inflammation, and that, I suppose, will help in the long run. So no harm, you know but
Mm.
again, make sure you get the right sort of dosages or get some right information before you simply go and take anything into your body. And remember, supplements supplement your lifestyle. They don't replace your lifestyle. So lifestyle is still the key.
Now, do people ever get over osteoarthritis? I mean, if you continuously take glucosamine like this, Hodges, do you actually get better, or is this something you just have to manage?
I suppose, yeah, I don't know whether you can reverse. I thought you can reverse, but I suppose you can prevent it from getting worse. So if make sure you don't get it into the later stage of the grade of the arthritis. The main thing is you want to be pain free, you want to be mobile to do all the activities, and you want to prevent the surgery. And I think that's where you have to look at all these other things to do, right exercise, right nutrition, the right supplements to support that, prevent it. And I suppose reducing inflammation is good because a lot of diseases today are secondary to inflammation. So reducing inflammation in the body, it will help prevent even the other diseases that we have. So I think that's important.
All right. Welcome once again. If you just joined us on a very special Facebook Live edition of the Healthwise Free Clinic, we are with our rock star doctor, Dr. Rajbans, president of the Malaysian Wellness Society, and he's here to answer all your medical questions. So log on to fb.lite.my right now if you're tuning in. Of course, you're already there, and you can ask questions there. Dr. Rajbans will answer it for you right now.
Now, there's a follow-up question to Liz's glucosamine and knee question by Ronnie Tam. Does reducing jogging activity in old age reduce knee joint issues?
Again, that's a actually very interesting, good question. Because uh, I see people, some are patients in their 80s still jogging. And they seem to be okay. And then I got others who have in their 50s and 60s already got knee problems and they stop jogging. So I think there must be a genetic component to that part of it. But again, doing it right, having the right technique of running. I think someone in sports medicine probably would do say this better, but right technique, wearing the right shoes, running on the right surface will definitely help. And if you start having pains, I would advise them to stop, because as you get older, the chances of going into more problems are there. Uh, for example, I stopped jogging long time ago. I go more into walking now because of the issues with my injuries to the knee. So for me, walking is brisk walking is what I do now. And so again, I think it's very individualized. If you're okay, you have got no pain, you're very good, you jog, nothing happens. Then fair enough, you carry on, especially if your doctor says you're fit to carry on. Um, but if you start having certain issues or pains and all, then I would actually not jog when you're older. Then I would actually go more for brisk walking. So again, depends on very individualized. Very difficult to say who can or who cannot, right? Because I mean, we see people in overseas who are in their 90s and hundreds who are still jogging. So
Yeah.
whether how they maintain and what probably there's all of us have our problems with our genes. So whether they are able to switch off that genome and they are able to run in that age. But I think majority of people as they get older, I would think that they should actually go more into brisk walking than to carry on jogging.
All right. Actually, Dr. Rajbans, your injuries, because you said that you actually have knee joint issues from all those years of playing hockey and whatnot. Do you get it specifically at when it? Because I have a friend who goes through that. He's older. He's around 60 plus. It happens only when it rains. It's not always. It's a constant thing. How do you manage that? I mean, when it's only based on weather and certain circumstances.
Yeah, I suppose the cold can aggravate. That's why a lot of people in winter in overseas, their joints seem to have caused more pain. That's why they love hot weather. They like to come here. I think cold aggravates surprisingly the pain in the joints. So I suppose keeping warm, using some heat therapies. There are a lot of gels and sprays out there that can help you to relieve that symptom during that acute phase. But now we know osteoarthritis is an acute inflammatory disease. Uh, so during the inflammation, you can try. Really painful, you might have to take certain medication. But if I get that issue, I just take things to reduce the inflammation, more of local gels, increase my, things like my turmeric and my omega 3s and try to reduce the inflammation. Then it normally goes away.
Mm-hmm. Would creams that you put, like those muscle creams and whatnot, help with knee pain or
Yeah,
knee
it can
joint
help.
pains?
Yeah, it does help. Can help to reduce the pain at least. I prefer more, there are a lot of even herbal stuff out there, herbal creams that are actually that you can apply that are a bit more safer. Sprays that are there, but I prefer that when you take oral pain medication because that have their own side effects. So use local therapies, heat therapy is one way to get, local gels or physiotherapy will help where they use in things like ultrasounds and all that too. So different modalities to see what to do with the pain.
Okay. Ronnie has a very funny input to your question, JD. It's like a built-in weather detection of incoming rain.
It is, yeah, exactly. People are, I
So
think
when it rains,
why? 'Cause I
you know
think
your
it's the
knees
pain,
are
yeah.
pain.
It's true,
Okay,
yeah.
going to rain now.
Thanks for that question, Ronnie, and for that input. Now we have another question that just came in from Aida Reza. She said that I have just had a full hysterectomy a week ago. Oh, hope you're feeling a little bit better now, Aida. I have heard that it is harder for us in experiencing induced menopause. Do we need supplements to help us with this? When can we start to take it after the surgery? So Aida just had a hysterectomy. Is it harder for her to now because she's going to experience menopause?
But were the ovaries intact or did they remove the ovaries? So that's the question in that there's
Ida,
no.
maybe you can follow up on that, yeah. So we can get more
Yeah,
information.
because if it's just hysterectomy, sometimes the doctors leave the ovaries so your hormones actually can still be there. You know? But if they remove the ovaries, then you're like basically going into menopause. And so again, the best is to discuss with the gynae what's the best option, because today we know that hormones replacement have their own issues. So if you are at risk of certain things like breast cancer and all that, the doctor might not want to give you hormone replacement. They might try other alternatives. Uh, but if you're not at risk and if you're going to get symptoms, so all depends also on the age, and so that's something you have to. I think your gynae will be the best person who operated on you to discuss with you what's the best option for her. Uh, again, healthy lifestyle, exercise, all that. So even though women when they go menopause, the estrogen and all progesterone goes down, but you remember our other hormones like the DHEA, pregnenolone, your growth hormones are all there, right? And all these respond to the healthy lifestyle, a good diet, exercise, sleep, stress, all that will reduce the bad hormones like cortisol, reduce the good hormones, and they can actually compensate for the hormones that they have lost, the estrogen and progesterone, right? So I know women who are very healthy, who have gone into menopause, but because they got a very healthy lifestyle, they don't get all the problems of menopause like others do. So I think it's important for her that a real good healthy lifestyle is there, but whether she needs any hormone replacement depends on whether ovaries are there or taken out, and if she does need, whether she's safe for her to take, so that the gynae has to discuss with her.
Actually, updated. You said removed ovaries.
Removed, huh? So definitely that means she
Yeah.
needs so she's the hormones are going to be low. So this is something really she's needs to discuss with her gynae and see whether she needs, and then for how long she needs, because they have to look at the overall history, risk of other problems. Some people are more prone for, like say, thrombosis, risk of breast cancer, family history, all that. The gynae has to look at all that and then see whether it's safe for her, and then how much to replace. All that is something again, the doctor did the operation for her, be the best person to discuss this with her.
How about supplements, doctor? Can she take any supplements to help with sort of delaying the onset of menopause or reducing the symptoms of menopause?
Yeah, I mean, do people do take things like evening primrose oil, omega threes? This is some of them do seem to help. They also herbals, but the herbal ones are just like your taking your hormone replacement. So again, that one she has to discuss with, like black cohort, she has to discuss with the gynae. But taking omega threes and EPOs, that should be quite safe. She can look at that first before she wants to try a HRT.
Okay. And she can take it now, 1 week after surgery, or should she wait a
I
little
think
while longer?
anything you just wait. All the surgery effects will go away in about 6 weeks. So I would wait until then and then sit down and discuss with the gynae or do our own research and see what's the best option for her.
Another question now from Errol. He said that he was on a wheelchair for 1 year. After discharge from hospital, I did physiotherapy, and then I started to take hyaluronic acid. And in 1 year, I could stand up and walk. So I cancelled my knee replacement operation. I'm 71 years old now. Wow.
Yeah.
For a year, and he could now stand up and walk.
Yeah. So I
That's a
suppose
good question there.
the combination of the physiotherapy and probably that was so if she's knees. I think his operation was what operation he was thinking of. They wanted to do for him. His knee, isn't it?
I think he cancelled his knee replacement operation. He was due for knee replacement operation, and it was so painful that he was on the wheelchair for a year. But he was discharged from the hospital. I'm not sure whether he went into the hospital for something or
Based
not.
on just taking this acid, he could walk again and didn't need knee replacement surgery. Is that?
Yeah. So I think
Is that?
it's I don't know because you don't know how bad his knee surgery, but he was definitely in pain because, and then of course he's affected his activities. So he's on a wheelchair. But like I said, arthritis is an inflammatory disease. It can flare up and come down, flare up again. Physiotherapy will definitely help. He's taken one of the supplements that like I said, there are many supplements out there, from glucosamine, chondroitin, MSM, the avocado, soya base, now hyaluronic acid. whether that actually helped or whether it was part of his disease, up flares up and going down, or whether the physiotherapy helped. And so I think probably it's a combination of all, and that's very good. If he's able to delay or even prevent his surgery, that would be good. So what exactly helped, we don't know. So I see that a lot of patients actually can have flare-ups and then they go away, and uh, whatever is done, I'm sure it was not only just the supplement and the physio, it's also probably his lifestyle that he must have improved. So all that will help. So good,
So
good
should he
for him. I
continue
think
taking it?
there's no harm. I think he carry on taking it, but I think just hope that the flare up doesn't come back. He should. I would actually even have to carry on the physiotherapy that he's doing. I mean, once you learn what to do, you can do it at home. The therapy, the exercises for your muscles, for your knee, and whatever else they have advised him to do, he can carry on at home.
Okay, hope that answers your question. Well, I think Errol was just trying to come in and talk to us about knee, like a
From
knee
the
surgery. We were talking about it earlier, right? Like how to avoid knee replacement surgery. Okay, now we received another message or a question from Wing Hong. What causes continuous purging, doctor? I've been experiencing it for the past 2 days. I went to the clinic this morning. They gave me charcoal tablets and loperamide. Please help.
I mean, gastroenteritis, probably that's what he has. Commonest cause is still infective, virus, uh, bacteria. If she got just diarrhea and no other symptoms like vomiting and fever, probably just a mild, viral thing. Rotavirus is very common for that. The other viruses, sometimes toxins, eating wrong food. Normally toxins, like food poisoning, you also get vomiting. So this, of course, these are very acute. So it just look like some sort of infective process. Sometimes people have sort of diarrhea, could be just, stress, irritable bowel syndrome. All that can cause diarrhea. But hers looks like very acute. So I think it's probably some sort of infection. So what they given her is the right thing: charcoal, loperamide, maybe some soft diet for the next 1-2 days, and it should settle. Now, if the diarrhea doesn't settle after 5 days, then it's something more chronic. So you go back and see the doctor. If any other new symptom develop, things like vomiting, abdominal pains, fever, then you must be worried whether it's going into something more serious like a bacterial thing. For example, Malaysia, things like typhoid, leptospira, any of the salmonella infection, all these can suddenly, cause diarrhea, and but symptoms are normally more severe. They'll have fever, and also hers looks like a very simple, straightforward sort of in viral, maybe diarrhea. It should settle with the medication and just avoiding sort of heavy meals and all that. Just some soft diet for the next 2-3 days. You should get better.
Speaking of salmonella, I remember reading this article about like almost 100 people in Terengganu who contracted sort of food poisoning from eating this pudding that they bought online, and it was because the eggs that make this pudding is expired and might contain some kind of bacteria. And it actually, unfortunately, one person actually died after being after a septic shock, I think, after being in the hospital for food poisoning.
Yeah, salmonella is the commonest we have is salmonella typhi, which is what we call as typhoid. And salmonella can be actually very aggressive infections. You can actually get septic, septic shock. People actually have died from salmonella infections. So again, it's a contaminated food, very common. We on and off. Recently in my hospital, last 3 months, I had about 10 cases of typhoid. And again, it's probably because of what they were eating or drinking. You know, so you must always be careful because this is quite endemic in Malaysia. On and off, we do get a sort of patients getting typhoid, salmonella infection. Uh, Rarely you get like this where they go for some sort of kanduri or dinner or party, and suddenly everyone gets infected because there's some infective source. But most individual infections are very common. So anyone coming to us with fever, abdominal pain, diarrhea, this is one of the standard tests we do. We used to be like, you got fever, we'll do dengue, we'll do for typhoid. Of course, now we do for COVID. So these are like standard tests that we do when somebody has symptoms of fever and abdominal pain and diarrhea, right? So earlier, her symptoms are just mostly diarrhea, so unlikely to be typhoid because that one normally is more severe. They get severe abdominal pains, they get vomiting, they can get diarrhea, high fevers. So Salmonella is normally more serious infection.
And if it's a stomach issue, maybe just cut down on the chili padi. That's my 2 cents worth right there.
Yeah, I wonder whether that was what she took.
Or the dairy. Or the dairy.
Those are lactose intolerance or a problem with dairy. Chili padi per se shouldn't, unless you are sort of sensitive.
Yeah, if
to it.
someone just has diarrhea, what kind of food should...
I would just go for soft diet.
Sorry,
maybe
today we
something-
are like crossing each other a lot because the internet connection is quite bad here.
So I think.
Can you hear me? Can anybody hear me?
Yeah, we can hear you. Yeah, I think you probably your mom or grandmother would have told you that when you get diarrhea, just stick to something very soft, like your porridge or soups or kanji and things like that. I think that's the way for the body to rest. We don't want to give it too much of things so that the stomach and the colon have to digest because it's already having an inflammatory infective process going on. So you want something light going into your especially fluids. So no oily food, no chili padis, and no sort of fried stuff that you want to take. So stick to soft diet and a lot of fluids.
Actually, Dr. Rajbans, when is it just like I ate too much chili padi and I've eaten too much spicy food and that's a stomach ache? When is it technically, officially, I had diarrhea, I had food poisoning? What's that line?
I don't know. I suppose you can, if you take a lot of chili padi and a stimulant, chili padi and spicy food are a stimulant. They stimulate your gut, so you could have some loose stools, right? But normally they don't run like watery stools that are continuous. And you'll have a bit of a colic a bit, and you have some loose stools, and they stop after 2-3 hours after the food you have eaten because it's a stimulant. Whereas if your infective process, it'll be continuous things. Like hers was going on for 2 days, so that's definitely not because of something she had. It's something that's going on, the infection or some sort of toxin. Or we thought other symptoms like
So you were saying earlier that if after 5 days she's still purging, then she should go and get another checkup.
Yeah, they go and check out because now you start thinking whether it's not a simple viral, sort of gastroenteritis. It's probably something different. Then we normally go and do things like blood tests, stool cultures to see what we are dealing with.
All right. We have Dr. Rajbans here with us. He's the president of the Malaysian Wellness Society, and this is the special edition of HealthWise Free Clinic. So if you have any medical questions at all, you can leave them down there at the comment section of our Facebook Live right now, and a doctor will answer them straight away. We received a question actually from Robert. His question is about this new norm. With us going back to work, we've grown accustomed to having to use hand disinfectants to keep us clean, but I've noticed my hands get incredibly dry and sometimes hurts. Is having too much disinfectant bad on our skin?
Yeah, I suppose the type of disinfectant, because a lot of them got alcohol, and if you're sensitive to that, you can have the dry skin. Even I have the same problem. If I use a lot of the strong alcohol ones, I get dry skin, and sometimes it gets like a bit painful. So like I use a lot of herbal ones now. There are also herbal sanitizers that are there, which are much gentler, much safer, and also just as effective. So you can try things like that. So look at your sanitizer and see whether it's something that's got too much of chemicals or alcohol, and then maybe change to something more gentler. Of course, again, don't get paranoid about that every few minutes you have to put the sanitizer on, because once you put it, unless you're going and touching places that are not sanitized. Let's say if you're in your office and it's a clean environment, or at home, you don't have to keep on putting that sanitizer. But if you're touching surfaces that are dirty, then you might want to do that. Or if you're meet someone that you're worried you want to use the sanitizer. But Yeah, some people are actually allergic to these sort of sanitizers and the chemicals. Um, so their option would be whether to wear gloves and then use the sanitizer. That's one option, or change to something that's less chemical based. So
Organic.
use herbal ones. Yeah. So those are quite
Mhm.
quite gentle, quite good, just as effective.
But those that are gentle and herbal based, do they kill germs and viruses as
I think
effectively as
they
the
have.
alcohol
I mean, they should be still quite safe, they whether they're as effective as the alcohol ones. But I think if you wash your hands, actually the best thing is if you can just wash your hands with soap and water. That is just as effective. And I use that a lot. As I do rounds in the hospital, every time I see a patient, I come back, I just wash my hands with the soap and water. I mean, wash means wash nicely, not just rinse your head. You just make sure you put the soap and water and really wash it. And it's most of the time much more effective and more gentle to your hands. So you can try that. Uh, but I think if you're having problems with allergy, or if you're going to have allergy and you have breakouts, in fact, that's more dangerous because now you got actually
Mm.
sort of a skin breakdown, and that's where more easier for other infections to even come in. So if you're getting that problem, change the sanitizer or wear gloves. Make sure
Mm-mm.
you don't spray.
I see a lot of people wearing gloves to go buy groceries, though. Do you think that's necessary or is it healthier in that way?
I mean, I don't think so it's necessary. So far, no one is from WHO to even Ministry of Health have not said that gloves are a must. Uh, I suppose if you are worried and maybe they have the same problem, they are allergic to sanitizers. So I know
Mm.
people have that issue. Then maybe, like I said, gloves is an alternative because if you put sanitizer on your glove, it's okay because you're not going to disturb the hands. So maybe that is something else you have to think of. But by just wearing gloves itself is not really necessary. Because I don't know, one asks us to wear gloves.
Mm.
In the hospitals, we
All right.
don't wear gloves unless we're examining a patient. Then we wear gloves
Okay.
because we have to examine. Yeah.
All right, let's move on to our next question from Siti Majiha. My husband came home last month after being cured of COVID-19, and now I am pregnant. Is my baby in danger of contracting COVID-19?
I'm sure they would have done his COVID test twice, and it definitely must be negative. Others would never release him out into the community, right? So once you're negative, then you're no more infective, lah. So it's no problem. She should be safe from him, But COVID is still out there, so she still has to take all the necessary precautions. But if husband has been cured, and they would have done to discharge you, they would have made sure they're too negative. And now they're saying that even after 14 days, COVID is not so infective anymore. So now they, in
Okay.
fact, as soon as you complete 14 days, they actually discharge you from the quarantine. So I think you don't have to worry.
I think she's worried about the baby because I think maybe she got pregnant after the husband came home after being
So I'm sure they would
discharged
have,
from hospital.
yeah, so he would have been negative, and I'm sure they would have screened her because she's
Uh.
in contact with someone who's positive. So I'm sure she would have been screened and she must be negative, right? Or other thing, whether they quarantine her and she got no symptoms, so should be no problem.
But does the
Actually,
virus
Doctor,
live on in the sperm? I guess that's what she's worried about.
No, but she would have had. I doubt that will be a issue. Because so far we got nothing to say that he can transmit that way. It's still the
Mm.
droplets that is transmitted.
actually,
Mm.
Doctor Rajbans, on the flip side of that, because the husband actually contracted COVID-19, he's cured. So I'm assuming he was positive at one point. He got over it. He's negative now, and then now they're pregnant with a baby. Will that baby automatically pick up antibodies for COVID-19? Is that how it also works?
We don't know. I'm not sure of that one. Uh, whether we're not even sure whether person with COVID can get antibodies because right now COVID is so new. Nobody seems to be sure. They say not everyone is, converting to, getting antibodies. So I think time will tell because COVID has been around only for 6 months. No one is really sure whether people actually do get immune. Is there a chance of herd immunity? No one really sure. And how many people convert to the antibody? We are not sure. So the baby part is a tougher question to ask. So I'm not really sure on that one. right? So, but I'm sure with in the due time, more information will be available, and we'll know much more about this disease. It is a novel virus, something new, so we don't know how it is. Is it going to be same like the other viruses that were before this, or H1N1, SARS, and all, or is
Mm.
COVID going to be different? Only time will tell. As we do more research.
What happens in H1N1 though? Something that we are more familiar with. Does it goes from mother
Transmit.
to baby? Does it transmit from mother to
No,
baby?
it's again a droplet. Most of the time, is contacted to someone, direct contact. So H1N1 is not transmitted that way.
Mm. All right.
But different from other viruses, like HIV, yes. So every virus seems to be different. They have their own sort of way they transmit. Some viruses are through mosquitoes, for example, dengue and all, right? But you don't get dengue from contact of people.
Yeah,
That
Mm.
means if
what's
I
the
got
focus
dengue and I,
have to be certain of dengue right now? Because I think
huh?
it's a season right now for dengue as
Yeah,
well.
so now dengue is in fact getting more than this thing. But if you got dengue and you cough to someone, the other person won't pick up dengue, right?
Yeah.
And it's also a virus. But a mosquito must bite you, person with dengue and bite you, then you can get dengue, right? So all these virus, all are so different. It's interesting that every
Unless you want
virus
to
seems
bite
to have their
someone
own
and then what?
characteristics.
They have different personalities.
Yeah,
Yeah.
maybe.
Virus.
Yeah.
Yeah.
So COVID, we have to wait and see how it behaves and what happens.
Yeah.
Okay. All right. We receive another question from Pam. After having a stroke, can my father continue his Tai Chi? Is it dangerous for his brain?
No,
This
I
question
think
from
if he's already on medication and he's the doctors have discharged him, he's uh, back to normal. I think Tai Chi is a very good exercise to do. I think it's a great exercise. Most people with strokes, we put them on a physiotherapy program anyway, which is a lot of exercise. We do a lot of rehab. They do sometimes 2 hours a day. So I think going on back to Tai Chi will be something I really would recommend to do. Go ahead, don't worry. As long as blood pressure is well controlled and he got no other issues, the doctor says safe to go home. He's on the medication. He should do Tai Chi because prevention is good. Tai Chi is help his muscles regain his strength, and it's actually a very good exercise post stroke. Qigong, Tai Chi, all these are good. Of course, he must make sure he don't overexert himself. But Tai Chi is a slow exercise, so I think it should be no issue.
All right. Is there anything that Pam has to look out for though after to care for a patient after suffering from stroke?
Yeah, I mean, strokes are there are many different types, whether it's a hemorrhagic, whether it's was it a block, an infarct, which part of the body, was it like a paralysis, or sometimes they just get, what they call upper motor neuron just over the face. So it's all different type of strokes. Uh, but once they've gone over the acute phase, now they have to look at rehabilitation. And most of the time we put medication to prevent further stroke, hypertension control that, diabetes, make sure you control it, cholesterol, we bring it down, and put them on an exercise program to rehab. So basically, he's now going to Tai Chi, which is sort of a rehab also. But if he gets complaints like, when he goes Tai Chi, he gets giddy or he feels unsteady, then quickly he must go and get checked up. Otherwise, if he's
Mm.
fine, then no issues, go ahead and just carry on.
Because the stroke is like it affects the brain, right? Just like how
Yes,
heart attack attacks the
yes,
heart, the
yes.
vein, the heart, it attacks the brain.
Yeah. So it's a brain attack. Instead of calling a heart attack, we call it a brain attack, right? But there are certain different types of strokes, where it's a bleed, hemorrhagic, which can be more serious, more severe, or blockage, where it just blocks one part of the artery, depending on which artery. So you can get like a complete weakness, or it can just can be complete zero, or you can get just mild. So all that varies. He seems to have recovered. If he can do Tai Chi, that means he's probably recovered from whatever that happened, and
Mm.
he now should actually go into an acute, active rehabilitation program, and Tai Chi is a good way to start.
All right. Thank you for that. So this is the free clinic with Dr. Rajbans. Rajbans on health-wise today. So if you have any medical questions at all, you can send them in to us right now on our comment section. Just type it there at the comment section and Dr. Rajbans will answer it for you immediately. And I think Liz has a follow-up question to her, to how she can work out.
Knee pain.
She's asking whether or not if she goes on the treadmill, it'll be okay for her with her knee pain. Because I think earlier we answered Ronnie's question, like, would it be okay to jog at an older age? So, is it okay to walk on the treadmill
Yeah,
if you
again,
have knee pain?
again depends on how severe your knee is or which grade of arthritis. But start off walking and see how. If there's no pain, that's a good way to start slowly building up your exercise. But I also wanted to learn to do some, exercises to strengthen her muscles around the knee, the quadriceps, and all that. Good, but I think walking is a very good exercise to maintain. And but start gentle. See if there's no pain, then you can slowly improve and build up on that. Of course, if there's any pain, then you have to stop and go back and see the doctor to see whether if something else needs to be done. Uh, but if there's no pain, then I think walking on treadmill. I suppose treadmill has got it still can cause a sort of stress on the knee, but if you go gentle and go slowly, you can actually slowly strengthen your knee and slowly build up from there. So
But actually, on that, a lot of athletes who have ACL injuries, they don't go on a treadmill. What they do is they actually do aqua, like they go into the pool, and then they train within that space. Is that something that Liz can
I mean, if you
explore?
can do that, it's very good because a lot of my patients who are old, who have osteoarthritis, who also want to exercise and they're scared of surgery or they're not fit for surgery. The best exercise for them is walk in the pool. No? That's the best exercise. It takes away the gravity takes away the pain, and
Low
it's a good
impact, right?
exercise. Yeah, just walking up and down the pool. And I had a 101-year-old lady whose granddaughters used to hold both her hands and walk up and down the pool, 10 times, right? So and she, I mean, 101, didn't want to operate on her knees, and so she had pain when she walked on normal surface, but walking the pool was fantastic for her, and went on to live another till 104. So that's a good exercise. We call it hydrotherapy in physio. So that's actually very good, very safe, no problems. You can actually do that.
Is there a place here in Malaysia that provides hydrotherapy that people can go to?
I think there are many places. I think there are one, two hospitals, I think, that provide hydrotherapy. You check out and see, but most of the places today don't because it's not easy to maintain these pools. And most people, don't want to share their, go to a place where other people also. So it's not taken off very well in this country. So I don't know whether there are any more still running out there because I think most of them actually stopped hydro pool. A lot of them now use a lot of special machines. There are special machines that are available that help you to strengthen your knee using this new technology and using new machines. A lot of them come from Europe and other places where they work on your knee, and these are just all machine based. So I think that's the trend today than to go back to things like old things like hydrotherapy. So that's where the physiotherapy are going into that, more into high tech ways to help improve your joint and your knees, and use things like braces and all that things to help stabilize the knee. So I think that's the way that is going. So I don't think so there are many hydrotherapy, but hydrotherapy basically you can find any pool anywhere and walk inside.
Which unfortunately you can't do right now because
Right now
pools
you
have not
can't lah.
been opened yet.
Yeah, so right now you can't.
Unfortunately,
Unless you're working staying in a place where you have a pool, for condos, then
yeah,
maybe you can do that.
yeah.
Yeah.
No, even condo pools are still closed to public, I
Is it?
think,
Oh,
unless you
okay.
have a
I
yeah.
mean, if you're
To
staying there, I think you can. Yeah, I don't know.
how about low tech knee guard, doc? Will that help?
I
Because
mean,
my
you can
grandma has
try.
been using knee guards for the
Yeah.
longest time. Like I don't know whether it helps or not.
Again, some people wear the knee guard and say the pain gets better, and they can walk. So go ahead, lah. You can try all these are simple things you can try first.
All right. Okay, thank you very much, Doctor, for that. Let's get to our final question from Magus. My husband recently developed an allergy to seafood. He's never had any issues before, so why would someone pick up allergies at 60 years old? Should I be concerned that he will develop other food allergies? And how can we check for that, Doctor?
Yeah, I think that's a good question because people have come and asked me this, that suddenly out of nowhere they've been, let's say, eating prawns all their life, and suddenly one day they took prawns and they got allergy. And I think it's not the prawn per se because all the seafood, one of the things they do is they are actually the scavengers of the sea.
Mm,
Things like your crabs,
Oh,
your mussels, and they probably have taken some toxin into their body. They have eaten that, and now you're eating that toxin, and probably that toxin is causing that allergy. So probably not the seafood. So I got people who have taken prawns all their life or mussels and never got, and then one day they get allergy, and then later they try again and they don't get the allergy anymore. So it could be some toxin in the seafood that actually caused the allergy at this age. Because if it's really allergic to prawn, you would have got it much earlier. And today, our sea is full of so many different toxins and things like your prawns, your mussels, your crabs are actually what they call filters of the sea. They actually filter these toxins, and this toxin can stay stuck in their body, right? And this is
mm,
even heavy metals now. They say we get from our seafood, so we must be careful of that. So that could be one of the reasons why you got allergy at this age. It's probably not from the seafood itself, but probably some toxin that was ingested by that seafood. So, uh, so on the other hand, whether it's getting allergy at this age normally is rare, or his system is changing, and this will be a first sign that he's
at
getting too much of
62?
uh, yeah, too much of free radicals, too much of inflammation in the body. Now your body is
mm,
changing, because allergies can occur suddenly. So he has to look back at his lifestyle and see whether anything there he needs to do. I would look at again foods that are reduce inflammation, take more probiotics to make sure your gut is good with healthy bacteria. Take foods that are more prebiotics, such as fiber, things like yogurt and all that, things like tempeh, all these things that are actually also natural probiotics. So you can go and look at taking all that to help, because this also could be a sign of a toxic gut syndrome and the leaky gut syndrome, they say. So these are some of the things you look at, but probably just the chance he's taken a seafood that has some toxin, and that was the one that caused the allergy.
So
Hopefully it won't come
I
back
think that's
again.
the
Yeah.
concern that suddenly he got seafood allergy, and then what's next? Like wheat. What's that? Gluten
gluten.
allergy.
Gluten and you see,
So it's
when
not that
that
because you get one allergy, you're gonna get other allergies as well,
not
right?
necessarily, unless his system is changing. That means he's going into a place where he's getting leaky gut syndrome,
Mm.
and his whole body's immune system is getting weak. That way, his inflammation going up, free radicals, and then he has to really look at, if he gets other allergy, then he has to really look at his lifestyle because he's already triggering
Mm,
something in him. If it's a one-off thing, then I wouldn't really worry.
All right. But it's strange
okay.
that like I could get an allergy out of the blue for no rhyme or reason just because what changes internally? Like it shouldn't I just be more tolerant? I can handle even more food because I'm much older now.
Not necessary. Again, your immune system can suddenly come active because of some foreign body that's entered inside, and that
Mm,
your immune system finds it as something that is different, so it can cause cause a reaction. So that could be how that allergy came about. So the immune system has got hyperactive. Whether you're low immunity or hyperactive immunity is an imbalance of the immune system. And again, a lot of things can trigger that. But basically, we know free radicals increases inflammation that causes cell disruption, whether it's your immune system or other cells. All these are the same
mm.
spectrum. Your cancers coming into it in the later part. So back to your lifestyle, back to the way your whole body is balanced. So, I it's like a tape recorder coming over again, back to your,
Right.
how you look after yourself. Yeah.
But is seafood allergy kind of common? It's do a lot of people have it?
Yeah. Yeah. I mean, not a lot. I think the gluten is more common now. Of course, dairy also becoming lactose intolerance coming. A lot of people blame the dairy and
I
all the
I'm getting
seafood.
that, Dr. Rajbans. I was like some milk I just cannot handle, and this is also out of the blue. I could do it like nothing before. Now it's just like at my, I think it was when I turned 40, maybe, that things started to
Yeah.
change.
Or your gut bacteria are changing. That means you're causing problem, damage to your gut bacteria. The good bacteria are getting affected, and this is coming in. So again, look at yourself and see whether something there that disturbing, you know. And if you're still early like that, try a good course of probiotics and see whether that helps to prevent this further. But back to
So,
lifestyle.
doctor, so if you get like hives and allergies all of a sudden, is it like symptomatic of something that's
One off,
about to
no.
happen?
One-off, no, because all of us can suddenly get exposure to a sudden, high dose of allergen. The body finds it. There's something foreign, and it can cause a sort of reaction, and it may never come back again. You know. So I got a patient who had never taken prawns all his life. Nothing happened. Went to Langkawi, took tiger prawns, and a severe allergic reaction. And after never, he's by mistake took prawns again a few months later, and nothing happened. And now he's back to eating prawns. So that one off was whether he's taken some toxin in that tiger prawn that caused that reaction and
Like,
never come
at
back
one point,
again. Yeah.
like this red tide thing, they were telling us not to eat the cockles and whatever, right?
Yeah. So it's again the toxin. So it might be a one-off thing, but if once recurrent, getting recurrent allergies, recurrent sinus problem, recurrent eczema, that shows your system is now gone into a hyperactive mode, and you have to reverse that. And then look at your overall lifestyle.
I see.
Okay. All right. I think that's all the time we have for today's
flown by.
Yeah, very fast.
It's 1 hour already. Thank you so much, Dr. Rajbans, for joining
you.
us for this
Thank you,
clinic,
Bel,
and
JD.
thank you everyone for your questions as well. Yep, we will see Dr. Rajbans in another 2 weeks, I think, for another round of free clinic.
Exactly.
So if you have any medical questions at all, you can still put it down below on our comment section, and we will answer them the next time.
Exactly. So we will see you again on the Light Breakfast. So tune in 6 to 10 a.m. every single weekday on the Light Breakfast. So we'll see you then. Thanks so much for tuning in.